Hi guys, in today's video we are going to be discussing about epulis. So epulis means on the gingiva. So it's basically a swelling which is arising from the mucoperiosteum of the gum. Now if you have to remember the subtypes with a mnemonic, it is PM, that is your Prime Minister's Fan Club Group. So all these letters are as PM is once, while F, C and G are twice. So F square, C square, G square. So this is the mnemonic. Just in case you forget the subtypes, you can go back to this mnemonic and figure out which one you are forgetting. So yeah, let's discuss about congenital epulis. So what we know till now is that epulis is something that is arising from the gum. So now we are discussing about congenital epulis. So as you can see in this picture, this is the swelling that is present in the mouth of the patient. So it is a benign condition and it is arising from the gum pads. It is seen in a newborn and it is more common in girls and it is more common in the upper jaw. Apart from that, it is well localized and it is a swelling from the gum. As you can see, it is firm and it bleeds on touch. So the treatment of choice is excision. And this is about congenital epulis. So it's a benign condition arising from the gum pads, more common in girls, more common in the upper jaw, and it is well localized, firm, bleeds on touch, and you treat it via excision. Coming to the next type, which is fibrous epulis. So fibrous epulis is the commonest form of epulis that you see. Again, it is a benign condition which is arising in the gum adjacent to a carious tooth. It is basically a fibroma from the periodontal membrane. Now, clinical features: it is painful, it is localized, it's a hard swelling, it bleeds on touch, and there is a carious tooth which is adjacent to the lesion. The differential diagnosis for fibrous epulis is squamous cell carcinoma, which arises from the gum, and for investigating whether this is a fibrous epulis, you might want to take an X-ray of the jaw, because it's really important to differentiate it from squamous cell carcinoma, since squamous cell carcinoma is a malignant condition. So a biopsy is really helpful. Apart from that, the treatment is where you have to again excise the lesion and you will also have to extract the adjacent tooth. So quickly summarizing fibrous epulis, it is the commonest type of epulis. It is a benign condition from the gum. It resembles squamous cell carcinoma. It is painful, it is localized, and it is a hard swelling which bleeds on touch. There is a carious tooth which is adjacent to the lesion and you investigate it by taking an X-ray of the jaw, OPG, or a biopsy from the lesion. Next is a pregnancy epulis. So basically, pregnant women will see this kind of lesion in their mouth. So this is basically due to inflammatory gingivitis. So pregnant women would see this kind of a lesion in their mouth. So this is basically due to inflammatory gingivitis and it is seen in the 3rd month of pregnancy. The differential diagnosis for pregnancy epulis is fibrous epulis and pyogenic granuloma. The treatment is often not required because it resolves after the delivery, but if it still persists, you might have to excise the lesion. So till now we've spoken about congenital, we've spoken about fibrous, and we've spoken about pregnancy. Now coming to myelomatic epulis. So myelomatic, from the name itself, you know that it is seen in leukemic patients. So these patients are investigated for leukemia and your treatment is the same treatment that you would give for leukemia. Next is granulomatous epulis. So granulomatous epulis is a mass of granulation tissue in the gum around a carious tooth. So like you can see here, there is a carious tooth and there is a mass of granulation tissue around it. So this is what is called as granulomatous epulis. Another one is giant cell epulis. So giant cell epulis is the osteoclastoma wherein there is ulceration and hemorrhage of the gum. So if the osteoclastoma causes ulceration and hemorrhage of the gum, that is called as giant cell epulis. Osteoclastoma we know has giant cells. Next, we have the carcinomatous epulis. So, carcinomatous epulis is the squamous cell carcinoma of the alveolus. It is localized, it is hard, and it is an indurated swelling with ulceration. Coming to fibrosarcomatous epulis, here it is a fibrosarcoma which is arising from the fibrous tissue of the gum. So, let's look at our mnemonic again and try to recall what each one of them means. So, first is P. P is pregnancy epulis, okay? So, in pregnancy epulis, we spoke about how it is due to inflammatory gingivitis and it happens during the 3rd month of pregnancy and it resolves after delivery. Then M. M is myelomatic epulis. Myelomatic epulis is the one that is arising in leukemic patients where you investigate and treat for leukemia. Next is F square. Where are our two F's? First is fibrous epulis, which is the most common type of epulis that you see. It's a benign condition arising in the gum adjacent to a carious tooth. It is localized, hard swelling, bleeds on touch, and the differential diagnosis is squamous cell carcinoma from the gum. You take and investigate with the help of an X-ray, OPG or a biopsy, and the treatment is excision and extraction of the carious tooth. Another F is fibrosarcomatous epulis, where it is a fibrosarcoma which is arising from the fibrous tissue of the gum. So we did F. Next is C. So C is congenital epulis, where it is a benign condition which is arising from the gum pads. It is seen in the newborn, most common in girls in the upper jaw. And the clinical features, again, it is a well localized swelling from the gum. It is firm, it bleeds on touch, and then you have to do an excision. Another C is carcinomatous epulis. So carcinomatous epulis is the squamous cell carcinoma of the alveolus. We spoke about how it is localized, hard, and an indurated swelling with ulceration. Next we came to G. So G, again you have two G's. So one is granulomatous epulis, which is here, and this is the mass of granulation tissue which is arising around a carious tooth. And then there is giant cell epulis also. Giant cell epulis is the osteoclastoma which is causing ulceration and hemorrhage of the gum. So this is it about this little topic which comes very frequently in an examination. So remember it with the help of this mnemonic, and if you know what the word is, like if you know what the heading is, I think you can just write about it because it's a very repetitive topic. So yeah, that's it about this video. I hope this mind map helped you, and see you guys on the next video.